there are communities of practice emerging to do gender equality work in a number of different settings. And we have, as the AGEP, we are actually caring for and looking after 4 communities of practice. One is in sports and recreation and the other one is in health. So okay. We've got, the Commission is trialling communities of practice in those particular sort of focus areas. But we also have 2 that are place-based. So anyone who's in the northwest region or anyone who's in the metropolitan eastern region can also participate in communities of practice. Some sectors are evolving their own groups. So it's not a bad, so that defined entities can work across the state and share knowledge and information about how they're doing their work. So if that's something that's of interest to you, please get in contact with me and or the Commission and talk about how that we might be able to support that. Those communities of practice can obviously exist about supporting organisations across organisational support, not within organisations. Within organisations, you really need to be sort of building your own internal infrastructure. Okay, I'm going to get underway. Just let Ashley come in and we'll get going. So just to remind you where we've been and where we're at. We've done all of our looking at the workplace gender audit data. Hopefully you've had a chance to reflect and review on the case study. And today, this afternoon, we're going to be doing a bit more of a hands-on process of looking at how do you create a case for change, strategies and measures, resources, monitoring and accountability. Again, just we acknowledge the traditional owners, and we particularly acknowledge our partnership with Koori Women Mean Business, which is deeply engaged in our work to ensure that we have an Indigenous intersectional lens in all that we do. Again, we'll be learning, listening, chatting, digital whiteboards, breakout groups, case studies, and just be mindful of that virtual presence. No more misty mountains up here. So hopefully internet connection is solid and good for the next 2 and a bit hours. Just to let you know, we do tend to find that this is a little bit shorter. So hopefully we might finish a little bit early today. Now I'm going to hand over to the lovely Justine, who's going to just take you through another Slido.
Okay, so hopefully you can all see that. So what are your key takeaways? Oh, hang on, sorry, wrong question. What are the key ideas and concepts that you took away from session 1? So we're just wanting a bit of information about what you've gained from session 1. Has everyone managed to get in? I'm assuming so. Oh, good.
Make sure the quantitative data is up to date.
Yeah.
Yeah.
Type your answer in there so we can record it and save it.
If you're having trouble with the Slido, just re-click in. So make sure that you refresh your QR code and try again, Jen.
Yep, so we're getting some answers. Intersectional data is important. We don't have to do everything at once. That's right. It's a process. It's not about perfection, it's about improvement. So it's about moving forward with the work. Incorporate intersectionality, importance of identifying opportunities for improvement and including those in your action plan. Yeah. Importance of intersectional data and how we use data, what to look out for as gaps in the data. Yeah. So setting that baseline, outlining insights and identifying gaps and areas for improvement. It's a learning process, definitely. We know, and the Commission is aware, you know, this is not something you've had to do and hasn't been your core business, and we're asking you to build it into that. So we know that it's a process and it's a learning process for you. Level of resources that exist to assist with our approach. Yeah, there are resources out there, and that the Commission's website is a great source of those resources. Like it outlines it all, outlines the steps. It gives you an easy approach to follow. Making sure diverse range of consultation methods and target groups are used. Yeah. Engagement with your team. Yeah, don't do it alone. This is not a one-woman job or a one-man job. This is something that you need to engage your whole organisation with, but it's very important that you have people around you that are helping you with this work to engage the whole organisation, and that leadership support is critical too, you know, making sure that, I mean, now that it is under the Act and you have to be compliant with that, I'm guessing that leadership will be on board. Why does the plan matter? Yep, so that's something that we talked about this morning, like why this is important work. You know, we know that gender equity is the key driver of violence against women, and improving gender equity within our society will improve lives for everyone, not just women. And it is not just one sector that can do this. So that's why there's this whole you know, strategy, bringing in a whole heap of sectors and making sure that we do achieve cultural change. All right, I think I've read out all of those. Thanks, Tanya. I will stop sharing that now.
Fantastic.
And back over to you. So thanks everyone. That was a really good indicator that you picked up on the things that Tanya was saying. Yeah, and as we said earlier, feel free to ask questions during the session if there's something that's unclear. Oh, sorry, Jen, that you couldn't get into that slide. Hopefully someone answered what you would have answered. Otherwise, type it in the chat if you like.
So just a reminder again about where we are in this timeline. What we've done, we've gone through and looked at how we use that baseline gender data and how important it is to meaningfully consult with your employees and stakeholders so they're engaged in co-design and contributing to the development of your gender equality action plan. Now we're going to talk about making the case for change, outlining strategies and leadership, measuring and monitoring. So making the case for change. What does this mean? So you know how we talked at the start about why we're doing this piece of work, why it's important for the state of Victoria to ensure that we're travelling towards a gender equal future. What the case for change is requiring of you in your AGEP is for you to adapt the principles of why we're pursuing gender equality to be tailored to your own organisation's journey. So what we're looking for here is for you to think through how gender equality is going to make a difference to your organisation and what role your organisation can specifically play given the nature of your existing work, what role it plays by creating a more gender equal focused organisation. So it's asking you to look at the Gender Equality Act principles and to consider how You are going to embed that in an overarching story of your GEP. And it's going to also ask you to reflect on that from an intersectional gender inequality perspective as well. So we don't just want it to be sort of like a white woman washing of this document. It needs to be more deeper than that. So a bit of a note on authenticity. Your vision needs to be more than just words on a page. So if you're getting into sort of departmental weaselly words, you're probably going off course. And you probably need to go back to your consultation process to look for the authenticity, because what you're hoping to do with this document is to make it transformational and something that is a really positive and living document for all of your staff so that it has meaning for them. What does an authentic case for change look like? Now that's looking a bit blurry to me. Is that looking blurry to you? Okay. I'll come back to that. So what we've got here are examples of an authentic case for change. On the left-hand side, we have Monash Health's. Is that, can I just check in with you, is that really blurry?
Yes, it is.
The text, the Monash Health text?
Yes.
Yes.
I don't know why that is, because it shouldn't be blurry like that, and it hasn't been on previous. I'm going to have to live with, I'm really sorry, I'm going to have to live with that, and I'll talk to you about what they've done just so that you get an understanding. I'm sorry about that. This is, on the left-hand side, you've got Monash Health's equity and inclusion strategy, which is currently in operation. And unfortunately, Justine, do you want to see if you can find that for me? Just online, and we might bring it up if we can.
The Monash one?
It's, yeah, Monash Health's equity and inclusion strategy. I'm not quite sure why that's gone blurry there. What they do, and you can see it on the other side. It's not an equity and inclusion strategy, but it's the vision for reconciliation, and this is legal aids. So again, both of these two documents are demonstrating a case for change. So they articulate really closely to the actual work of what they do, why their desire for, in legal aid's case, it is for reconciliation and Indigenous inclusion, why their particular role as a legal service provider is important to delivering outcomes that are improving outcomes for ATSI people. Monash Health has done the same thing. Unfortunately, we can't see it, but what they are saying there in their commitment is they've got a particular health focus. And so they
will link in the chat, Tanya, sorry, if you want to.
Great, fantastic. So if you want to have a look at that commitment and aims, what Monash Health then does is look at how its particular work is shaped and could be shaped by gender equality, and then it starts to outline a very unique role with clear commitments for how that's going to do that. So I'm just going to see if we can just go back. I'm going to stop that share and look and see if we can bring this up for a moment.
You're right.
Did I disappear for a moment? I did.
Do you want me to share it?
Yeah, if you can, that would be great. That's better.
Which bit do you want? That bit, the commitments?
Yeah, just that. So they're not, it's not words, it's not, you know, it's not been overly comms and finessed, but it is about specifically addressing from it the Monash Health's perspective, why it's important to serve and promote fair opportunity and resources for their patients and for their staff and the community. Why there's a customer service element of why they would want to create a safe and welcoming environment. There's also the importance that they also talk about the importance of accessible and inclusive workplaces. So, you know, maybe if I was a little bit critical, maybe it could be a little bit more dynamism in the commitment, a little bit, but it does its job. Okay, then it starts to outline some of the bigger picture goals of what it's trying to achieve as well, and making them more tailored. And as you can see, there's a mix of service focus and also workforce development. So the diversity and inclusion strategy is both driving towards the improvement of their core business and driving to improve outcomes for the staff that work within the organisation. So it's doing a double shift, really. Okay, so what we're going to do now is we're actually going to go into breakout rooms for just a little bit, and we're going to go back to our case studies. I want us to have a look at in the case study that you have, I want you to have a look at that and give me some feedback about whether or not you think that they have articulated a case for change. What's the Department of Community Education's case for change? So Arundhati, we're going to pop everybody into rooms right now. So if you want to join, you can join in. We'll be there for just 5 minutes this time. Okay, we won't spend too long on that today because I've got a fair bit to get through. So I'm going to go on to the next screen. And just to remind you that your case for change needs to be intersectional. So again, you're going back and having a look at your data and making sure that that it is being aware of diversity beyond just gender. And we encourage you to, you know, again, make use of your consultation processes and the resources, the human resources that you have within your organisations to enable that to be effective. Has anyone got any questions about intersectionality in the case for change at all? Okay. So now we're going to get to the to what I think is really the meat of your gender equality action plan, and that is, how do you outline your strategies and measures for the various gaps or challenges that your organisation has identified after you have conducted and analysed your baseline data. So we're going to talk about what you can do, like what are you going to write in your plans that are going to say you're creating change for gender equality. So to begin with, obviously you've done that exercise of collecting and collating and analysing and setting the baseline. So you'll tell the story in your document about where you are in relation to each of the GE Act indicators. And then if it's revealed that you've got a challenge in relation to one of those areas, you're going to need to show how you are planning to address those gaps and challenges and make reasonable and material progress towards them. And that is the public reporting exercise that you will have to do as you demonstrate to the Commission that you have taken the steps that are reasonable to actually show that you've materially progressed from what your baseline actually is. Again, all of this is very much referred back to, if you're struggling with understanding this beyond this presentation today, please go back to the guidance for defined entities. It's a very detailed document that the Commission has prepared for you. So what makes a good strategy and measure? You know, I imagine in this room that there are some very, very, very experienced strategic planners within this state government here who've probably been engaged in delivering and thinking through strategies and measures and outcomes frameworks for some fairly complicated public policy. So I don't want to in any way to tell you how to suck eggs here, because I recognise your own expertise in this space. Having said that, you know, we're encouraging you, if this is new to you, to just remember those SMART principles of the importance of being specific, measurable, achievable, realistic, and ensuring that there is timeliness in delivery. So a really important thing with gender equality planning and making sure that you're going to be able to show reasonable material progress is ensuring that what you're going to try to change is capable of having evidence collected against it. So if you have a too much of an amorphous, generalized statement about, you know, for example, women in our organisation are going to be happy by 2025. My answer to you is, and you are going to collect that data in what way? How are you going to provide evidence that you've made material progress against that? How do you actually resource the fact that if the answer coming out of your, you know, people survey is that actually women are really unhappy in your workplace? What are your strategies going to be? How are you going to resource the change that you're going to need for that? So it's important that you are applying that that exercise of thinking about what is actually tangible and measurable. You also want the content to be relatable and relevant so that it's informed by the evidence that you've got and the consultations that you've conducted. There's that question there, can your organisation appreciate the value of this work? That's a really great AGEP is going to talk to your wider strategic planning documents. So one of the things when you ask me, I need a template, one of the first things I'm going to say to you is go and get your existing organisation's templates for change. It's strategic planning templates. And you need to look at how you can use them so that they're familiar to your leadership teams a lot, so that this business of gender equality becomes aligned and integrated into your core business. And of course, you know, you also need to make sure that all of your strategies and measures are actually going to be delivering to the vision, that the overall case for change that you are working towards and the things that you're committing to achieve. This is better. So here's Monash Health's strategy again. You can see that what they have here are some key actions. So what are they going to do? They're going to increase transparency in workforce management processes to identify areas of gender inequality by including reporting annual gender ratios for each discipline, conducting a gender pay gap analysis, implementing gender neutral and transparent selection processes for leadership positions, and addressing any structural, financial, cultural barriers to accessing parental leave entitlements. Now, what I noticed there is they're very tight, really tight, tangible measures, and they really are going to be able to report back against that when they need to do their own self-critical awareness. Because in this case, Monash Health has just done that because they feel it's good and important to the performance of their business. They haven't had to have a stick to do it. They've just wanted to do it, right? You want your leadership team to come to this document really thinking that it's going to make an impact for them in a broader sense. And I will come back and talk to that towards the end. Relatable and relevant. So I've picked up two things here that I think make their strategy relatable and relevant. We will commission accessible breastfeeding rooms at all main hospital sites. Where do you think that came from? Any ideas? Well, that's come from consultation, hasn't it? That's not come from the data. That's
No, people are asking for it.
That's right. That's come from talking. That's where you're rich. And when you see that, of all of the things that are there, there's something that actually does tug at you when you look at that particular key action, because there is an awareness that there's real humans behind that particular key action. Another way that they've made it really relatable is that they've, what have they done? They've picked out their people. They've decided to spotlight their people and actually say, this is why it's important to us. I'm involved in this work and this is my day-to-day role, but the reason we're doing this work is because blah, 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 blah. It always just helps to make your strategy just that little bit more authentic by being able to do that. And again, those things, all of those strategies and measures, those things that they're going to be working on, start to answer the commitment that Monash Health has on the other side. So they want their workforce to be more inclusive. They said that, and so their key actions are answering that in relation to that first dot point. They want to be able to ensure that their patients are also experiencing a gender equal workforce too, and get the benefit of that. So, the breastfeeding rooms, workplace flexibility and gender balance in leadership teams is also has got a service offering as well, because it's about, who do their patients see as being the leaders within their organisations? Who do the patients actually see and engage with when critical decisions are being made about their healthcare? Any questions about that?
Tanya, I was just going to comment. Yeah, I like that use of an individual to highlight it. I'm wondering if they could even, rather than using the chair of the Gender Equity Committee, as they've got there, the Angelie, they could maybe use a patient or a nurse or somebody kind of a bit further down the hierarchy, if you like, who wouldn't necessarily be expected to have a particular stake in that gender equity issue, just to make it even more, if you are wanting to make it seem really broad and relatable. That might have also been a nice strategy too, because they've clearly got it there in quite a few of their actions, as you pointed out, but just having that personal comment from kind of, someone a bit more on the ground might have been nice as well. I
think this gets to it also comes back to this, what's mandated and what's recommended. So just remember, what's mandated in this strategy is only reporting on the workforce change data internal to your organisation. But something that is almost, what you've touched on is that there's almost an inevitability. Then in order to tell the story about why you want to change as an organisation, why you want to be more gender equal, it's really hard to not go back to the core business of what you already do, why you're doing your core work, which is why I imagine that there will be a number of defined entities, I think, that will do both. They will go, okay, well, we have to do gender impact assessments, so we may as well include planning, like a strategic approach for GIAs as well as a strategic process for the workforce. You don't have to do that, though. The Commission's not expecting that. but you're right. Like where are you from in?
So I'm almost thinking ours could be something to do with the students, the kids, young people, and what kind of world we want for them. And that would be, I imagine, an obvious point to try and make some of this messaging around them as the ultimate, you know, receivers of the work that we're doing. That might be a nice way of framing it.
Absolutely. And, you know, in DET, in some places of DET across, you know, the public education system, it may be that there are parts of this conversation where, you know, it's actually revealing for young people to reflect on the access and participation that they have of men in the workforce, and the exposure that they have, that children have to male teachers, may be a part of the frame of reference of this document as well for you, right? So as you start to position your thinking and about how you want to articulate what you're trying to achieve, yeah, I think that you're right, that you by thinking about your core parts of your delivery, you are also adding to the authenticity here. And you know, I imagine for DET there are some areas in the key actions that might be different than in other organisations where there's maybe less female dominated participation. Yeah. Okay, so what I'm going to do is we're going to go and spend a bit longer back into breakout group again. And I think this will be the last breakout group that we do, because I don't want you to get breakout grouped exhausted.
Tanya, before you go on, there's a question in the chat that you might want to address. Can you clarify how specific gender equity action plan needs to be? Kiana says she was under the impression that because it's a 4-year plan, it would include high-level strategies, and then the implementation or the annual work plans would include the more detailed actions.
Kiana, I'm going to be honest with you and say that's not, I don't know entirely the answer to that. My impression, though, of what we've been asked to do to support you is that you're creating the plan, the strategy, and like any strategic plan document, there will need to be, and as I said to you, you guys have got lots more experience about doing this at a very high level of policy development. There will be a process of annualised implementation in order to, it's the only way to hit your material progress targets, to do it that way. Does the Commission expect to see, you know, and I've been around in the public sector enough, does the Commission expect to see very, very superficial headlining without a bit more granular detail? I'd be nervous for you if you did that. I think that there's a bit more of a requirement to think through, you know, they're asking you to articulate your strategies and measures. They're asking you to articulate that a little bit. So yeah, I think that it's a little bit more than just saying, oh, you know, it's this high level and that's it.
Yeah, no, that makes sense. I guess it's about finding that balance around, you know, we've started consultation and there's lots of great actions coming out, but kind of some of them can be quite similar, or just wanting to make sure we don't end up with like a 50-page document, but also wanting to keep it, you know, specific and actionable as well. So we're just trying to juggle that at the moment, because we do have other, you know, plans like our Aboriginal Employment Plan, for example, which is a 60-page document, and yeah, it can be quite challenging to implement something that large.
Yeah, can I say to you, I think if you're that big, it's almost unworkable. You know, like I'm not suggesting, you'll see obviously the Department for Community Education had a plan to a page. I don't think the Commission wants to see a plan to a page, but I really don't think the Commission wants to see a 60-page document. And I think you'd be flogging yourself unnecessarily if that was the kind of level of you know, of analysis and activity that you were doing. Frankly, I think that your audit data enough and alone, which you have to attach to the plan in any event, is going to be quite dense. But yeah, there is a striking of the balance. And again, you know, like I do my own strategic planning, and I often find that there is a real tension between deciding which things, how much detail do you go into in relation to each strategy about how you're physically going to implement it? How much are you going to let your existing staff evolve to achieve the change? I think the key is really about making sure that if you've got an idea of where you want to land, of what your measurable indicators are going to be at the end, and you've got some indication of what your key strategies are going to be. You know, like if we go back and look at Monash Health's there, you know, reporting annual gender ratios for each discipline, that's probably as far as you can get in terms of an implementation strategy at this point. So it's the statement and commitment about what you're going to do. It's that commitment of what you're going to do, but it doesn't put any requirement on you to go into more detail about what it is how you're going to implement that. But, you know, again, go back to, this is why I say to have a look at your own organisation's preferences in that. I don't know. Like at TAC, there might be a real desire that you might have a model for how you do your reporting that is focused on, that has, you know, your key strategies, X number of indicators, and then your measures and a timeline. And that's how you like it to be, presented. Adopt that, use that, and bring that into so that when you are able to, you know, show your document to the rest of the organisation, you can see alignment there. All right, we're going to give you a chance to have a look at the Department for Community Education. Can we pop you back into breakout groups?
What are the questions for this breakout group again, Tanya? Can you share that?
Yes. So you're going to have a look at the case to a page, case for change, which is just on a page or so. And you're going to say, what are the strategies and measures that they've adopted? Is there anything that's missing? Is anything unrealistic or unhelpful? All right, join your room now. You've got 10 minutes to do this. You know, at this point, there's a bit of heavy lifting that's required from everybody to make sure that we're not, you know, gifting to people further down the line something that's just impossible to achieve.
We did have a quick chat though about that achievement piece, Tanya, just about how a bit of concern about if we did set quotas and didn't meet them, you know, that we couldn't meet them. And we had a discussion around, well, that, you know, that gives you the opportunity for further identifying some strategies that might contribute, that perhaps your strategies are a bit off or your targets were a bit high, or, you know, that there could be that readjustment at the next phase that happens, like that it's not the end of the world if you do not meet those numbers. But it's better to have some numbers in there to have some direction, you know.
Look, this is where you, at this point right now, you've got people in this room with you who've physically done this and implemented strategies and measures that have actually worked to shift entities that have been gender unequal to being more gender equal. And in terms of thinking through what strategies work, I wanted to just showcase to you things that have got that evidentially work, that are part of gender equity by design. So if you aren't familiar with the work of Iris Bonnet, check out her book, Gender Equality by Design. These are strategies that actually work in gender equality change. So if you want to shift, for gender equality, it's important to set targets. If you
I've
really
included
want to
some articles in the chat if people are interested in reading more about that.
If you wanted to do that, it is demonstrably true that just the process of talking about where you want to go, not you know, flogging yourself to get there and punishing yourself when you don't, but just setting those targets changes behavior. It's a behavioral change process internally. So it really is very effective at getting you somewhere. The point is about targets, and I'm going to come back to this statement again, is and I say this all the time, it's called the beauty of persistent incrementalism. You don't set targets to create, if you set a target to create a revolution overnight, the only thing that's going to happen is a backlash against what you're trying to achieve. So effective gender equality strategies take a little time so that you build institutional capacity and belief in the benefit of that change and enable the change to be long lasting and owned by everybody. So I'll come back to that question of the beauty of persistent incrementalism. Other things that work. You need pipeline strategies. So in anything that you're doing around workforce change, if you're focused on, if you've got areas that are patchy in terms of the participation of men, women, or gender diverse people, you're going to need to institute some form of pipeline project like mentoring, training, sponsorship. They work. The other two things that work in delivering gender equality are basically forms of communication, because the Gender Equality Act itself is the meta version of what I'm about to talk about. What drives change for gender equality is talking about it and transparently discussing, lifting the veil off the knowledge and being honest about what you're actually delivering in your organisations, and whether your commitments to say that you're committed to human rights principles of, you know, gender equality, whether that you actually live them in your day-to-day work. So transparency, the process of reporting and having to deliver, and so that this is why the Gender Equality Act has been written in the way that it has. It is requiring defined entities to analyse, set targets, and then transparently report, because that will change behaviour. There will be competitive tensions. Organisations will not want to see their reports. You tell me, what's going to happen if the Department of Justice comes out and says, look at us, we've instituted this, 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 and this, and in 5 years' time we're gender equal, and look at how wonderful we are, and we're going to get an award from somebody for having done it as well. You can bet your bottom dollars that like competitive federalism, competitive tension between departments will also drive performance improvements. And you actually want that. That's what you're trying to in part create by the transparency, is you want people to be accountable for what they're supposed to be delivering. So when you're thinking about, you can use any one or combination of some of these techniques to help you shift and make change. Is there anything, Justine, that you wanted to add to that at all?
No, that was very thorough. I've put some links in the chat about training that's available in Victoria, and also the author Iris Bonnet of that book that you recommend.
I might just stop there because there's a lot to absorb about that. And I know, you know, I'm very, very familiar with talking about targets and quotas. And so I know that it's often a controversial space to reflect about those things. you know, to talk about them, and what might be going through some of your heads is, oh, like, I just don't know if our organisation is going to be committed to that. You know, just the first thing is that eventually the Commission has actually got the capacity to set targets in various parts of defined entities and start talking about those things. There's that power in the Act, but she's not going to use that straight up. You know, it's about encouraging organisations to set their own frameworks. So there's certainly a sticker element to it. But in terms of, I can't more strongly talk about how effective they are, particularly when you have, you know, I've seen organisations where there have been, you know, significant pockets of resistance to the target because they think it rubs up against the concept of merit advancement and they don't like it. But because it's so effective, like, it's the most effective form of transformation. And if you set your targets so that they are incremental, this is what I mean about the beauty of persistent incrementalism. If you set them so that that it's not a revolutionary change, it's a slower change, then you can actually build organisational commitment to it. And anywhere where there are pockets of resistance will start to be transformed and have their minds changed because of the effectiveness of them. Any comments or questions or reflections at this point? Feel free to challenge. I'm happy for that. Okay, nope. All right, now I promised you we're going to try to finish a bit earlier. I'll do my best. So now we've moved away from the strategies and measures and what you'll need to include in those. And now we're talking about something that I think is, you know, a bit vexed, which is how do you actually get the resourcing to make reasonable material change? What is your organisation going to be telling the Commission that you're basically putting behind this project? Because let's face it, if you were in your day job and someone said you're going to have to deliver the XYZ program in your in the ABC community, first question you'd ask is, what have I got to spend? It's the same with this project. So things for you to consider is, you know, is there any way that your existing existing resourcing that might be already allocated to do something else within your organisation can potentially be used to do this work? So how are you planning to situate this part of the planning into your broader strategic planning? How are you going to start thinking about, okay, so you want to have a measurable outcome of you know, of having an increase in the uptake of access to the breastfeeding room in your department. You know, what investments will you be making towards trying to promote that service within your organisation? What will you do? Do you really need to consult about the alignment of leadership and resourcing in a broader sense? No, but you definitely need to make sure that your leadership team is on top of understanding how important it is. So a AGEP that doesn't explain to the Commission what you're going to do to support it isn't a complete AGEP. Oh, am I going backwards? So I just wanted to show you a little bit about the importance of doing a strategic resource plan for your strategy. Again, there's not a lot of resources about this easily accessible on the net, which does show you the way that, that some of this work is still at the cutting edge of things. But what I have been able to find for you is a city council in Ottawa in Canada. And this is how they basically they've got their gender equality action plan, but then they have got a specific priority to make sure that there's gender sensitive resource allocation. So you can see here that they're, identifying the area of the departments that's going to be engaged in it. They look at their strategic actions, and bear in mind, this is very outward focusing, so I'm conscious of that. But they list the detailed action, and then they're talking about what kinds of resources and facilities and that they're going to contribute. So you can do it that way, and it doesn't necessarily deal with the dollars and cents in any way. And that's perfectly acceptable. And on the other side, we've got another document which I think is from UNICEF from memory. And so what they do is they're actually tracking the percentage of their expenditure that is going towards gender equality. So they're actually tracking that and being accountable for that in a different way. And they're also tracking and reporting on staffing and capacity across the organisation. So looking at dedicated resources, gender equity specialists that are contained within the organisation. So that's how they provide accountability. So, that sense of leadership that you're looking for, to have that buy-in by your senior executive level, you need that. You're going to need that. But you definitely need your individual change agents. And I've heard a few of you speak today with quite a great deal of passion about this work. That energy will drive change within the organisation. You've been asked to come and do this course today for a reason. They're looking to your leadership to help them understand what they need to do, and how you report back and talk about this today and what you said in train today will help shape the leadership attitudes to this as well. There's something to be said about using your lived experience and expertise, using those conversations that you have with your consultants, that you're consulting with staff, to help change, the thinking of your leadership teams about this as well, if there's any forms of resistance. Nothing's better than talking about the 5 staff members who haven't got access to a room to pump breast milk, for example. Like, you've got to use lived experience to try to shape that as well.
I've put in the chat the Encountering Resistance resource. So that goes through some real life examples of things that people might say, to question your work or to push back a little bit, and it gives you responses, as well as the Kelly questions when we're talking about prevention of violence work. So that has some questions people ask and some answers that you can give.
That's awesome, Justine.
Pleasure.
Thank you. No worries. I think I have to say, life is better when there is opportunities to see how other people do it. So, even at Google research is still a good friend. So if you are going to be responsible for doing some of this into the future, then you going online and just doing some of those basic research searches and getting access to some of our links that Justine's providing to you, so that you get a heads up about who's doing a good job of it. That's a really useful thing to do. So don't be ashamed to just go back to those sort of basic things to find out some of the answers. And again, that defined entities resource is really good that the Commission has developed. So we're now on to that process of thinking about measuring and monitoring your progress. So you actually have to do reports every second year to the public. They're required on your progress towards achieving your gender equality action plan. It's recommended that you're tracking it annually though. And probably to do that well, it totally makes sense. If you don't have this already, your organisation should have some form of diversity and inclusion or gender equality committee in operation, because it's just one person on their own isn't going to be able to shift and change organisational behaviour. One person's not going to be able to do the, to actually physically be in charge of all of the data collection and the analysis and the preparation of the report. It's just not possible. You need a team, and you're going to need a team to track all of the various projects that might flow out that you're going to try to do to show the material and reasonable progress. Again, there's that statement around, you know, making sure that you do set sensible timing. Don't leave timing off, and don't make timing so impossible to achieve that your organisation feels devastated by having not made it, because that also works against, in terms of behavioural change, that also works against maintaining commitment to the journey of gender equality. It takes, so that statement, the beauty of persistent incrementalism, it's mine. I've said it twice. It's actually a typo. It's not narcissism. But, you know, it is there for a few, it is there because I believe it, having delivered this kind of work. If I had delivered a target of 50-50 within 12 months, I would have failed. I would have pissed people off, and I would have lost the capacity to bring people with me on the journey for change. So targets so we specifically used targets, but then we also had a combination of pipeline activities, because if you set a target, you've got to make sure that you've got pipeline, right? We then set targets that could be sensibly achieved over time, aiming to get to the concept of gender equality.
Tanya, can I ask, would you include those pipeline actions within the strategy? Yeah.
Yeah. I would, you know, and if it would be like it, you could, I'm a big believer in targets, obviously, but I would also say to you that a target on its own without the pipeline can just as easily fail, because you set something that you've got that you haven't done any strategy to overcome barriers that might be there to get there. So you actually have to think that through. Yeah. So I would definitely try, if you decide that you're going to do that, that's a good idea. Some organisations, look, when I go and talk to organisations about transforming for gender equality, and I get to this conversation around targets in particular, you know, some organisations are just not, they just don't want to hear that. It's too hard. So one of the ways to talk about it is to actually talk about the pipeline activity. So talk about how you're training and mentoring and developing people, because the next logical step is when that doesn't work, because you're now looking at it, and I'll say to you, just looking at it, so coming back to these forums where you come in and you force your leadership team to look at the data and they have to analyse it, will start to make people uncomfortable and go, okay, something's wrong here, right? So just looking at it is enough. But if you then, you know, you start a pipeline and you start demystifying this idea that merit is the only thing that merit is something that, you know, you need to overcome in these conversations around, eventually people come to the concept that that something is structurally wrong. And so you've got to do what I call a special measure, what is commonly known in gender equality activity. You've got to do that special measure to correct the imbalance, because something's going wrong. It just doesn't make sense anymore. Any questions or comments about that? Good monitoring, what does that look like? You know, you're basically what you're wanting, you're basically wanting to show numbers, percentages, time. So you want to, when you're talking about how you're going to be monitoring your progress, you want to say the number of things that have now become blah, 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 the time that has been saved in blah, 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 the percentage of change difference in blah, blah, blah. So how frequent the take-up reporting service has been accessed. Any other evidence that you might determine, but those things then become generally the things that will help you, you know, make sure that you're monitoring your progress and you've got your measures that you're looking at how you're performing very clear. And you know, you want them, remember that concept of being tangible and measurable. The more tangible, the more measurable, the more capable that, the more tangible and measurable it is, the more easy it's going to be to get your resourcing. So if you have something really specific and measurable that can be delivered, then you can explain, we're going to get from A to B, but we need C to get to A to B. That's easier than saying, oh, we're going to get to B. B's where we want to go, but we're not quite sure, you know, how. That's where you start, where people go, oh, I don't want to give any money to that. So if you can use your phone again and touch on the QR code, what are your key takeaways from this session? What have you learnt? Use the SMART goals. Awesome. How good Slido? That's what I learnt when I started doing these. How good Slido. This is kind of fun. I like using my phone. Importance of resource. What have we got, Justine?
Importance of SMART goals, use of SMART goals, importance of ensuring resources and time are allocated, that they feel more comfortable that where they're at in the process, that's good, that intersectionality is important, and to make sure that mission and vision align with goals and actions. Perfect.
There is a lot of work to do.
Yeah, resources are important. You're going to have to find them.
Keep those.
A lot of great learning, SMART goals, intersectionality. Yep. I think your key takeaways highlight that where we made our case study intentionally bad is where you've really learned, you know, it's like, oh, that looks terrible. We better not do that. We need some SMART goals. So that's great. Need more support to deliver this work. Currently have sole responsibility. Okay, that's not great. First step is gathering a little working group together.
Absolutely. That's really, whoever that said, and obviously we don't want you to disclose that, but whoever said that, that's part of the resourcing that we're talking about.
People power as well as financial stuff. Get leadership buy-in. Oh, it's critical. And even if it's about, you know, that's your first training rollout is with leaders. Like if you've got to do that, that's a great start. Align to existing strategies. Yeah. Relate strategies back to your organisation and data. Intersectionality. Consult, engage, and use existing organisational structure and governing bodies. Yeah.
Fantastic.
Definitely need more resources. Yeah, we all do. I think have a look at those. The two different examples we gave you in the chat, the links to resourcing, because they are very different and, you know, they're both legitimate. But also have a look at other people's strategies. You know, there's nothing that is saying you have to reinvent the wheel. You can steal ideas and things that are relevant to your organisation as well. We have, sorry, go for it.
Oh, sorry, go on. Yep. Go, no, go.
I was going to go to the next question. That's all.
Yes. Yep, sounds good.
So just the last Slido is what other support, information and or training do you think you would require now? Nothing. Great. You're all onto it.
Yeah, the communities of practice are great, are good.
Do you know, Tanya, are they rolling those out for government departments or is it just not yet?
At this point, there's just, at this stage, we have, we understand that, well, I do understand that I thought that there was a diversity and inclusion across, not a COP per se, but a network across the whole of the public service. I need to check.
Yeah. I'll just read out a few of these things that people would like. Examples of a best practice, gender equity action plan. Yes. I think Tanya said that that's possibly something coming down in the future. There is a VPS Women of Colour network, also VPS Pride network. Oh, fabulous. Agree on the sharing of GEEPs being developed. Need to watch the pre-recorded gender audit training session. Yes, if you haven't done that, I would recommend that. Sharing drafts. It's hard to answer. It's very overwhelming. It is overwhelming, but it is, if you go on the Commission website, it really is, it steps it out. It's a step-by-step process. So don't feel overwhelmed. Just, I guess, the antidote to overwhelm is action for me. Like, just get on that website and have a look at those steps and see where you can start. Collaboration with other government departments. Well, Kate's just given you an opportunity there. It would be great to establish a network, and the community of practice sounds great. Yeah, it really is good sharing because everyone's at different stages and you can learn from each other. It's a great model.
For those of you who might still be, is that all we've got in terms of our questions, Justine?
Yes, I'll stop sharing.
For those of you who might be still feeling a bit overwhelmed, I just wanted to share with you some final things to just reflect on. So we've covered a lot of ground today, but we acknowledge that, you know, you can't do everything in a one-day workshop, and that the journey for gender equality for many individuals here, but also organisations, might be at very different stages across the people who are here today. So some of you might, you know, feel like you're at an advanced stage and you're just picking up a few little tidbits here, and there are others here for who this is all brand new. The reason the Commission has created a panel of providers who are basically experts in this work, which is what the Action for Gender Equality Partnership is. The reason we exist is because for some organisations, doing this change right now is just too much and you need help. We're here for that. So the Commission's not expecting you that if it is too much for your organisation and you don't think you can handle it on your own, you need to reach out to one of the panel of providers to ask for assistance. Now, the assistance isn't free. These sessions are free because the Commission is making them available for free as part of capacity building. But the work to, you know, to get extra help isn't free. But our job is to work with you to basically support a affordable, workable solution for you within your organisation, so that you get to the 1st of December feeling proud of what you're handing in and that you're on top of it. Now, you know, what I don't want to have happen, particularly for organisations that are here today, who are represented here today, what I don't want to have happen out of this is that you contact me in September telling me you need to land your Jeep by October because your leadership team needs it, right? You need to, I'm anticipating that might happen, right? We're here now to help you. So there's lots of us. There's other panel of providers. So there's other organisations that you can go to. It's not just us. But we've got, what you're looking at here is a huge operation of organisations that really know their stuff in this space and who can even tailor it to your place-based region. So it probably is not so relevant for all of you in sort of statutory agencies and government departments, but place-based responses to gender equality are quite important in a number of different places. We can help with all of that. Things that might be useful to you. So in a few weeks' time, Gender Equity Victoria has its annual conference called Defining Equity, which is a gender equity policy and exchange conference. So it's an opportunity to learn around key issues. We will be running a workshop which will be giving you a taster of Vic Health's framing gender equity work, which is how you deal a little bit with resistance and change to gender equity and what sort of information that you need to provide. So you can come along to Defining Equity. We're promoting that on our website at the moment and find some information about that. We also run workshops in Introduction to Gender Equality across Victoria, what works in gender equity design. We also look at targets and quotas and the beauty of persistent incrementalism and helping us do them. We provide that consulting support so we can help you with reviewing and analysing that gender order data, can help you perform gender impact assessments, undertake any capacity building for GE across your organisation. So if you need L&D support because you want to take people on the journey, we can help you nut that out with you. And of course, we're here to help you with actually drafting the Gender Equality Action Plan if that's what you need. So that's it from the AGEP. Thanks so much for being with us today. I wish you a safe lockdown number 5 and enjoy yourselves. Good luck with your gender equality transformation. Anything from you,
everyone.
Christine?